Welcome to Unit 2 of the Quick Start Guide for Recovery from Addiction and Co-Occurring Disorders. In this unit, we're going to be discussing relapse prevention planning. You're going to learn about the stages of recovery and personal relapse warning signs for addiction, anger, anxiety, and depression. We're going to identify relapse triggers and ways to prevent and mitigate them. You're going to identify protective factors and ways to enhance them and begin creating a relapse prevention plan. You're going to finish up by reviewing the Serenity Prayer and aspects of locus of control. So let's get started. Stages of Recovery, Unit 2, Part 1. In this part, you're going to learn about the stages of recovery from addiction, anger, anxiety, depression, and I start to identify personal relapse warning signs in each stage. It's important to remember that relapse means a return to a prior state of being, and it can apply to mood disorders, it can apply to health issues, and it can apply to addiction. And we're really going to start learning a lot about how all three of those things are intertwined. Recovery from any of those things begins when you make the decision to stop using, or in the case of physical health or mental health issues, to get better. Getting clean or recovering means allowing your body to be free from the overstimulation of the addictive behavior and ranges from 1 to 3 months. So the first 1 to 3 months is going to be the initial recovery period. However, post-acute withdrawal syndrome can last for up to 2 years. It's important to recognize that what you did over 10 years is probably not going to be undone in 10 weeks. You're going to have little fits and spurts of issues with, mood symptoms or cravings that you need to prepare to deal with. Sobriety means not using and acting in your sober self in a new recovery lifestyle. Obviously, this pertains specifically to addiction issues. Recovery overall is an end goal in which you are clean, sober, happy, and healthy. When you have an addiction or mental health issue, it impacts your body as well as your mood and your thinking. And remember, it can take up to 2 years for your brain and body to reach maximum recovery. So let's think about all of those things. What will you do or have you done in a recovery lifestyle? When you've been in recovery before, what have you done that is maybe different from what you're doing now, such as eating healthfully, getting good sleep, thinking differently, hanging out with different people? I want you to start brainstorming those things. Spend about 20 minutes thinking about when you were in a recovery lifestyle, when you were not struggling with addiction or mental health issues, what were you doing that was helpful? And write those down on a piece of paper. Once you do that, I want you to spend another 30 minutes thinking about how your addiction or mental health issue impacts your physical health, your mood, your thinking, your behavior, and your relationships. So what you can do is take a piece of paper. Legal is easier because it's longer, but you can take a piece of paper and create columns, one for health, one for mood, one for thinking, one for behavior, and one for relationships. And in each one of those columns, I want you to identify how your addiction has affected each one of those areas. And if you've got mood issues or mental health issues, I want you to also identify in each one of those columns how those issues have been impacted or have impacted your health, your mood, your thinking, behavior, and relationships. The goal is to help you see that things are intertwined, and addiction isn't just impacting one area of your life. It's impacting multiple areas. Same thing with mood issues. And in order to achieve full recovery, it's going to be important to address the problems that were caused by your addiction or your mental health issues in each one of those areas. The first stage of recovery is the withdrawal period. And this is when you are ceasing using any sort of addictive behavior. It can be substances, it can be pornography, it can be gambling, whatever it is. You are ceasing use of that. Now, your brain has gotten used to, it's habituated to those surges of dopamine and feel-good chemicals caused by the addiction. So even if you weren't using substances themselves, if you were engaging in addictive behavior, your brain is expecting those surges of brain chemicals. And when it doesn't get those, you're going to feel some symptoms of withdrawal. Some of those symptoms can include craving. You think about it a lot. You want it. You feel like you need it. And it's going to be important to put the phrase in front of that. When you start having a craving, tell yourself, I am having the thought that I have to have this, because thoughts come and go. Craving is your body's way of saying, I really need that surge. I really need that surge so I can feel, quote, normal, whatever that is for you. And cravings do pass. Generally, if you distract yourself or do something else, a lot of times cravings will pass in, 20 minutes or so. But it's important to recognize that cravings are a symptom. Depression is going to be a symptom. As your body goes through withdrawals, your brain chemicals are sort of out of whack. And a lot of people use, in order to feel better, in order to self-medicate depression or anxiety. So when they're not using anymore, their brain, they don't have anything to, quote, medicate those mood symptoms, to increase the brain chemicals that are responsible for helping them feel happy. So you may feel depressed. One of the general rules we use is your withdrawal symptoms are generally the opposite of your using symptoms. So if you were using stimulants, you are probably going to feel depressed during the withdrawal period. If you were using depressants or opioids, you are probably going to feel more anxious, more agitated during the withdrawal period. And in the case of opioids, you're probably going to experience an increase in pain for a short period of time. Low energy, difficulty sleeping, increased appetite, or sometimes decreased appetite, but usually increased appetite, are also common during the withdrawal period. When your brain chemicals are out of whack, it's not as able often to produce melatonin to help you sleep. Your circadian rhythms are probably not in balance, which is going to make it difficult to sleep. And when you are going through withdrawal, that is perceived as a stressor by your brain. So it is activating your stress response system, which is the HPA axis. And I'm going to talk about that a lot throughout the various units. And all of those things are going to contribute to difficulty sleeping in the short term until your brain and your body chemistry stabilizes again. Appetite often increases because your body is craving the building blocks in order to recover. You may have difficulty concentrating because the stress causes brain fog, the activation of that HPA axis. Lack of sleep can contribute to a lot of brain fog, and we'll discuss that more in the unit on sleep. Anxiety and irritability, as I mentioned, also may increase, partly because you don't feel well. However, if you were also abusing substances that were depressive in nature, they tended to calm you down, and or alcohol, which has both effects, you may experience significant anxiety and irritability in this early withdrawal period. Knowing it is half the battle, and then planning for how to deal with it, that's where we're going now. I want you to think about your personal relapse warning signs during the withdrawal period. Which symptoms do you have during this period that often trigger you to go back and start using again? Once you identify what your particular relapse warning signs are during the withdrawal period, I want you to identify 2 or 3 ways to deal with each one. So, for example, most people, if you are going through withdrawals from some sort of substance or process addiction, behavioral addiction, you're going to experience cravings. I spend 30 minutes identifying ways to deal with each of your withdrawal symptoms. So what are 2 or 3 ways you can deal with cravings when you have them? What are 2 or 3 ways you can deal with depression or low energy when you have it, in order to prevent yourself from going back to relapsing, going back to using? This will take about 30 minutes to go through this activity, but this is one of the more important activities to do in early recovery, because these withdrawal symptoms can be really strong, and they can really make you question whether you can recover, and it can really make you question whether you want to recover. And it's important to have tools to deal with it, because you know, if you're watching this video, you do want to recover. So making sure that you have an arsenal ready to deal with these things when they come your direction is going to be really important. Recovery begins when you make the decision to stop using. In the case of addictions, getting clean means allowing your body to be free from the overstimulation of the addictive behaviors. A lot of people have multiple addictions. Some may be behavioral, some may be chemical. Sobriety means not using, and that means not using your substance or behavior of choice or any other addictive behavior. So not using and acting in your sober self in a new recovery lifestyle. Your relapse prevention plan needs to identify your personal relapse warning signs and 2 or 3 ways you can deal with each one. And we're going to be adding to that throughout this entire unit. It's important to review your list daily of your relapse warning signs and what you need to do to continue on your recovery lifestyle. And identify vulnerabilities. You know, what things may be happening today. If you wake up in the morning and you know that depression is a relapse warning sign for you, and you wake up in the morning and you're depressed, you know, that is a red flag that says, okay, I need to do something right now before it becomes any worse of a problem. So review your list of relapse warning signs every morning and a couple times during the day if you need to identify any vulnerabilities you may currently be experiencing and steps you need to take right then and there to stay clean and sober.